why does or why should a person think that he needs antibiotic? Is it self-determined by him or her, or is it advised or suggested to him by somebody? My humble submission is, take antibiotics only on the prescription of a doctor. If your neighbor tells you that he had similar symptoms and he took this antibiotic and got better, and he still has few tablets left with him, and you borrow it from him and take it, then you are inviting AMR, because anything taken in subtherapeutic dose, anything taken without your having infection, I am talking of the antibiotics, will ultimately lead to antimicrobial resistance. AMR will affect every aspect of healthcare, every aspect of the patient care, whether it is transplant or a simple pneumonia, or for that matter even a wound infection. We are slowly turning into a situation where antibiotics are losing effectiveness, especially in the what we call them as superbugs. We are reaching a stage in which the resistance is as high as 90% and going up to 100%. So that means all those antibiotics which were working on these bugs are not working on them anymore. In fact, the majority part of the antibiotics produced are not used on human beings. It is used in the animal husbandry. That is where it is used for reasons which are not related to infection. They are used for increasing the meat production. If the animals develop AMR, we eat them, and then the same bugs come into us, and for no reason and no fault of the doctors, the antibiotic resistance is passed on from the food animals to the human beings. So that is another thing that people have to be aware of it, that they must kind of put pressure on the vet industry or to the people who are into this business of meat business, that they should refrain from using these antibiotics to increase the meat production. The government should have campaigns. Above that, the very people who dispense these medicines over the counter, they need to be targeted. I know that for them it is business and for them it is money, but somewhere they have to be socially conscious, and they should be the one who should be dissuading people that no, we will not give you antibiotics. And of course the people should know that taking rampant antibiotics is not good for them. So the biggest question is, who to blame? Who is increasing the AMR? I think we all are to be blamed. The blame could be at different times, it could be to a different degree, but it is not happening by chance. It is happening by a design that we don't want to divide, we don't want to challenge, we don't want to do away with. And that starts right from the healthcare providers, or rather from the government, going to a common man on the street. Everybody has to realize his contribution to the increasing AMR. AMR cannot be done away with, but we can contain it, we can increase the shelf life of these antibiotics, the lifespan of these antibiotics, because trust me, there are no new antibiotics coming up. You have what you have, you burn them out, you make them ineffective, and you will reach the pre-antibiotic era. And that is a dreadful scenario. Thank you.